Hello, I'm just going to go through some neck exercises for you. So I've actually had a couple of patients in recently that have had various injuries to their necks, so like road traffic accidents. One of them is also really noticed an increase in her neck pain after she'd had her C-section. I know you're going to think that's really strange because it's very far away from your C-section, but our fascia and our connective tissue is all linked. So if you have a tension or a tightness in one part of your fascial line, in this case the frontal line of your tummy, and it's pulling on that area, you can feel it potentially all the way through into your neck. So there's lots of different reasons why people have sore necks, and I think particularly at the moment when we're doing a lot of work at our computers at home, potentially in postures that aren't great, we're potentially doing a lot more sort of chin poking, rounded shoulders positions, and maybe we're less mobile. We can get lots of aching and pain in our necks. So a little bit of a disclaimer before I start any of these exercises. Obviously, if you are having any specific neck injuries, do make sure that you are assessed by a professional first. If you feel sick or dizzy or unwell during any of the exercise, just slowly stop and seek some medical advice. These are some general exercises that hopefully will help you to feel a little bit more range of movement and less tension through your neck. So let's get started, and I just want to start with a few rolls back of our shoulder. And I always roll back because if you're rolling forwards, you can actually find that you're increasing the tension and the activation of your pecs, which we tend to be already rounded. So always roll backwards with your shoulders. Okay, then you're going to do gentle movements going into a half clock face from 3, 6 to 9 and back again. And if you feel any sort of clicks or crunches, as long as it's not painful, that's absolutely normal and fine. Just keep it nice and gentle and smooth movement. Try not to be vigorous with your neck, with your movements. Then you're going to look over one shoulder and then over the other shoulder. Now, I've done this a few times today already, but if this is the first time you're doing this, just maybe pause the video now and just spend a couple of moments just practicing working your way through. So now I'm going to the top half of the semicircle, up and round. Now what I want you to do is gently, you're going to pull down on your chest. So you're going to pull down on your tissues of your chest and come down, and then you're gently going to look up. Now as you look up, you're going to want to open your mouth potentially, but I want you to look up and then practice just moving your mouth up and down. I always think I must look really strange in this, but hopefully it's only me that you can all laugh at, because you guys will be just on your own doing it in your comfort of your own home. But it's really important to stretch through all of the neck muscles. So now you're going to come up to one side, and you're going to pull down in the opposite direction. So if you bring your head to your right hand side, you're going to pull down to the left side. So you're going to go the opposite way with your hands. And that should increase the stretch through there. And again, move your jaw. And then through the other side. And take note, you might find that you are sore on one side than the other. And this can be for various reasons. So grab your earlobes now, and you're gently going to stretch through your earlobes. Now it's going to seem a little bit strange, but just gently loosen off through your ear as I'm talking to you, and do the other side. Now you're going to find that potentially one side is tighter than the other, and that may be because you've been hit by a road traffic accident on one side. Perhaps it's because you've had lots of dental work in the past and lots of jaw stuff. Maybe you grind your teeth, or in my case I've had lots of ear surgery in the past. So this side for me is a lot tighter. So really working through that side just to try and loosen any tension spots off. And sometimes you get a little popping of your ears, almost like you're on an aeroplane. So just gently move your jaw and just pop any tension that's through your ears. Coming on to what we call our TMJ now, which is our joint just through here. You're going to pop your hands on that joint and gently move your jaw up and down, and then side to side. And then you're going to come down underneath your chin and gently massage through any tension spots through there. And then I would even pop your hands and just gently help to give yourself a little bit of a gentle figure of 8. Now just be super careful, because if you're in pain, this might be a bit too much for you. So just work on your own limits. Take a couple of nice deep breaths in. Try and relax your shoulders when you take a deep breath in, so feel your tummy. And out. In. And out. And there we go. I hope you enjoyed that, guys. Just a lot of a variety of some neck, shoulder and fascial stretches and self-massage techniques. Any questions, do bob me a message, and hopefully I can help you. All right, speak to you soon. Bye.